Dr. Eric Newman, and I'm the Clinical Director of Accident Care Chiropractic and Massage. By now, you have met with one of our expert chiropractors and been evaluated for your injuries as a result of your car accident. I'd like to take a moment to explain a little bit more about your injuries and help you understand what's going on in your body. For many of you, this is your first accident, and you may have some questions about why you're feeling certain symptoms. Also, what kind of treatments you'll be receiving at Accident Care and how long it's going to take to get better. Being involved in a car accident can be a very traumatic experience and almost always result in injuries to the spine. Cars are designed to a certain extent to absorb some of the forces, but nowadays with vehicles on average being 4,000 pounds, that force will inevitably transfer through the car into the occupants of the vehicle, resulting in whiplash and other injuries. In whiplash injuries, the first force is transferred through the low back, which will result in injuries to the ligaments and move bones out of place. If you are twisted, have your foot on the brake, or involved in a side impact, you're likely to experience injury to the disc. The force is then transferred through the rest of the spine into the shoulders and then ultimately to the neck. Once the force has arrived in the neck, there is a rapid compression, extension, and flexion motion of the neck, giving it that whip-like motion, ultimately resulting in injuries to the muscles and ligaments. Once an injury to the spine has occurred, it is critical that you receive appropriate treatment in order to avoid complications down the road. Things like further disc damage or even arthritic changes. The treatment that you will be receiving at Accident Care will help ensure that there are no complications in the future. One of the most common questions that we get at Accident Care is how long is it going to take to feel back to normal? Although there are many factors that go into determining the heal time, most injuries will fall into 3 categories of care. There will be the critical phase, the maintenance phase, and the functional phase. The critical phase will be the first 4 to 6 weeks of your care. Treatment will be provided 3 to 4 times a week, depending on the severity of your injuries. The goal of this phase is to decrease inflammation and pain, along with returning you to activities that can be safely performed. Your doctor may prescribe time off work or have you avoid certain activities that will worsen your injuries. The next phase is the maintenance phase. This phase of care preserves the work accomplished in the critical phase. It is normal to experience occasional flare-ups during this phase. Your doctor will monitor progress and determine which therapies are most beneficial. An MRI or a specialist referral may be indicated if your injuries are not healing in the expected time frame. More exercises are prescribed to prevent major setbacks. This phase of care typically lasts 4 to 8 weeks with 2 treatments per week. The final phase of care is the functional phase. Your treatment will be focused on the area that poses the greatest risk of returning once your treatment has completed. The vast majority of our patients experience 100% recovery with their treatment and will not need further therapy. However, in some instances, the doctor will need to focus on continued strengthening and give you management tools to make sure your symptoms don't return. This phase of care will last anywhere from 4 to 8 weeks, with treatment being received once a week or once every 2 weeks. We all know someone who had a car accident 10, 20, or 30 years ago, and they still have headaches, neck and back pain. This is because they did not get the right treatment. It is our responsibility at Accident Care to make sure you get the right treatment so you can recover.